On today's episode, I'm talking about what the causes and solutions are to a cat who keeps toileting in the kitchen, which is clearly disgusting. I'm then moving on to how to help an old dog who's showing signs of weakness and starting to suffer from some mobility issues, before then moving on to how to help a dog cope who's starting to show signs of senility and dementia. But before we get into all that, here's the intro.
Welcome to Call the Vet, the show that answers all your dog and cat questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Welcome to episode 27 of Call the Vet. I'm Dr. Alex, the veterinarian behind ourpetshealth.com, and my aim is to give you the information that you need really to help you look after your dog or your cat to the best of your ability. And I'm really grateful that you're here sharing your valuable time with me. I know there's loads of other things that you could be doing or other things that you could be listening to, and so I hope you find some kind of really great facts, some great information out of these podcasts. And if we're meeting for the first time, then make sure that you're subscribed to this podcast if you enjoy today's show. I've got loads more valuable episodes lined up that you won't want to miss, and you can also get your question answered just by heading over to callthevet.org. And so I'm going to jump into my first question, which was sent in by Brandy. And Brandy wrote in and said that she's got a 2-year-old tabby. He knows where the litter box is, but is starting peeing next to the kitchen sink and pooping under the table. So what Brandy did is that she blocked him from going into the kitchen, and then he goes into his litter box. But as soon as he's reintroduced to the kitchen, he repeats this process. What can Brandy do to stop this problem? So the first thing to say is that spraying or urinating and also defecating outside the litter box in cats who's otherwise well litter trained, then it's generally due to either an illness or a health issue or because of a stress problem. So health problems can be numerous. They can include things like cystitis, so an inflammation of the bladder. That's sometimes an infection, sometimes due to a bladder infection, but very often actually it's just a general inflammation. And that's probably the most common problem of urinating outside the litter tray, especially in younger cats. Now you can also get things like arthritis, so an older cat who's struggling to get into the litter tray may start toileting kind of outside the tray if they've got kidney disease, diabetes, if they've got diarrhea and they're not making the toilet. So either they're producing a lot of kind of stools and when you got to go, or they're producing a lot of urine and their kidneys aren't concentrating the urine, in kidney disease and diabetes, for example, and then they need the toilet and just can't quite get there. So we've definitely got to have it in mind that health problems could be causing this. That said, stress is the most likely cause if the cat is otherwise toileting normally when they're excluded from the kitchen. So are they going to the litter tray? Are they assuming the normal position, kind of squatting down? Are they toileting normally? They're not straining a lot. They're otherwise, absolutely fine. Then stress is the most likely cause. And there's a number of reasons for stress. Sometimes it's just impossible to get to the bottom of it. But stressful things can include things like litter tray placement. So is it overlooked by other cats? Even if it's through a window, is the litter tray right by the cat flap or by the window or by, somewhere where other cats can see in? And so the cat feels threatened when they're using that tray. So cats really do like their privacy. Are there other cats coming into the house? That's another big cause of stress. It's a huge cause of stress, probably one of the biggest ones that there is. If you imagine someone who you don't want there coming into your house, you can kind of then sympathize with your cat. And it's actually really common, especially if you've got your cat's food bowls by the cat flap. They're coming in, they're tempted to come in, and you may not even notice that because it may be happening at night. And, if you're at the other end of the house, you're not hearing that happening. Other causes of stress can be things like fireworks, roadworks, renovation work in your house. It can be even just house visitors, a new baby, or even just a change of routine. And sometimes even just a change of weather as well can be enough to set off a problem. So what we need to do is first we need to make sure that there's no health problems. So that's always going to be a good thing to do, to get your cat checked over, especially if it's a recurring problem that you can't seem to get to the bottom of. Then we always need to be mindful that there might be a health problem that needs specific treatment. And taking your cat to the vet, if possible, get a urine sample, maybe take a stool sample as well in this cat's case, just to make sure that there's nothing else that we should be doing or worrying about or investigating. So make sure there's no health concerns. Stress relief is the next thing that we need to try and do. So if you can identify the cause of stress and then try and eliminate that or reduce that, then that's fantastic. We need to make sure there's enough resources. So resources is very important to cats, especially if this is a multi-cat household. And I'm not sure if Brandy's got one or just one cat, or if there's more cats in the house. But for those of you with multiple cats in the house, then competition for litter boxes, litter trays, for food bowls, for water bowls is a really big source of stress. And the recommendations generally are that there should be one more than the number of cats that there are in the house. So if you've got 3 cats, for example, you should have 4 litter trays, 4 food bowls, 4 water bowls, all in separate locations, and certainly food, water, and should be separate from litter trays. So yeah, that's one thing we can do. Secure the house is another way. So make sure that you don't have strange cats coming into your house, stressing your cat out. You can do that with special cat flaps. So they can either be the magnetic ones that your cat wears kind of a magnet around their neck attached to their collar to open up the litter tray. But you can also get microchip cat flaps. Now, I've actually got a microchip cat flap. It's a Sure flap. I'll leave a link in the show notes of my review of that. I've had that for probably about 7 years now or so, and the plastic's getting a little bit brittle because it's been in the sun, and it's actually been with me kind of on several house moves, but it's still working really well, and I definitely recommend those if you've got other cats coming into the house. It just works with your cat's normal microchip, and yeah, they're fantastic. Screen windows, so if you've got cats kind of looking in, even if they can't come in, then actually if you could put like a bit of frosting screening or something like that on the window so your cat can't see them, that will help. And then litter tray placement is also really important. So cats, like I say, they don't like being overlooked, but also they don't like the ability or the potential for another cat to kind of leap out and pounce on them. So they often will quite like kind of the trays being in a corner, because that way they can view the rest of the room and there's no way that another cat can be hiding and kind of pounce out on them. And then other forms of stress relief, or other things that we can help with stress to reduce stress, include things like pheromones. So there's something called Fellaway, which is a naturally produced pheromone that cats produce when they rub their cheeks against something. They're releasing this pheromone into their environment that lets them know that this is their territory, this is their safe space, and that they can, really relax in their home environment. So Fellaway is the synthetic version of that pheromone, and it comes in like a plug-in air diffuser, kind of air freshener kind of thing. Like, we can't smell it, you won't notice it's there, but your cat will. And it also comes as a spray, which is great for things like car travel if you're taking your cat to the vet. Maybe not so much in this situation. And then there are other supplements, so things like Carmex or Zilkine can also help. They're kind of herbal supplements. They've got things in them that may be beneficial just to help relax your cat. Now, for serious stressful situations and for seriously stressed cats, there are pharmaceutical drugs that can be used to help reduce that stress, but that would definitely be something to talk with your vet, and is generally not the first thing that we reach for when we're thinking about dealing with a cat who's peeing or pooing outside of the litter tray. Other things I should mention as well is that some cats are really fussy with the litter, so maybe just try changing the litter. That might help. So they might not like a scented litter if that's what you're choosing. They might not like a clay-based litter because that can clump in their feet and they really don't like it. And cats, if they don't like something, they're not going to do it. They were kind of put on this world to test us from that point of view, and that, they are their own masters. So changing litter might be another helpful suggestion. And then the other important thing is to make sure you clean up properly after your cat, so both where they're peeing and where they're pooping outside of the tray, because cats will often be attracted back to the same spots again and again by what's in their stool and in their urine, and they'll just keep going back because it will become their toilet because of the scent that is given off. So don't use a bleach or an ammonia based cleaner. The best thing to do is use an enzymatic cleaner, so that's got enzymes in it that will help break down everything that's in the urine and in the poop and stop your cat being attracted back. And again, I'll leave links to those in the show notes. And so at this point, before I jump into the next question, I just wanted to let you know that this podcast today is brought to you by my free guide to solving problem peeing in cats, and also my guide to stressing cats. So these guys are perfect for helping you recognize the signs of stress in your cat, helping you get to the bottom of them, helping you to come up with a strategy to help reduce the stress in your cat, and then giving you some excellent pointers to help solve problem peeing in cats. So if you're having any of those problems, and even if you're wondering if your cat might be stressed, and believe me, it is actually a really common thing that a lot of us don't recognize in our cats, then make sure you head over to ourpetshealth.com/resources to download these free guides today. And then up next is a question from Wendy, who writes, right now I have an aging chocolate lab who seems to be having some cognitive difficulties or is just becoming defiant and demanding. He's been well trained with a personal trainer for years and he's regressed. When I crate him at night, he barks until he falls asleep. He repeats this in the morning when he wakes at 5 o'clock in the morning. I try not to respond as I'm trying not to reinforce the behaviour. What else should I do? And then Wendy also adds that he also seems to be having some spinal problems and weakening in his hind end. What can I do to help him maintain his strength? Okay, so there's really a couple of questions here, and rather than kind of cram my answer into one slot, I'm going to actually break this down into two separate questions, and they're going to be how to help a dog with weakness in his back end and spinal problems, and then how to help a dog who's showing signs of senility and dementia. And so I'm going to tackle the issue with comfort and mobility first. So recognizing the signs of pain and taking action early is really important. So, it's great that Wendy has recognized that her dog is struggling and that he seems to be weak in his back end. He's maybe having some spinal problems. So recognizing that problem is really important, but taking action is important as well. Too many times, unfortunately, signs of pain are not recognized as signs of pain, and then if they are kind of recognized that, okay, my dog's a little bit uncomfortable, then they're just taken as part of the normal aging process, that it's not important that we do anything. It's nothing that we can actually do, and your dog is just left to live with that. So neither of those situations should be the case. But once we've recognised the signs of pain and we want to take early action, we actually need to be certain of that diagnosis. So Wendy's dog is an older chocolate lab, and Labradors, they are, really high sufferers with arthritis, although a lot of dogs are sufferers with arthritis, and maybe we're just not picking up on that. But, Labradors, they do get arthritis, especially in their back end, so in their hips, in their knees, potentially also in their backs. But, Wendy also says spinal problems, and, it might be that there is a disc disease. There's a slip disc, so intervertebral disc disease, something like that going on. Now, that's not something that we'll often see in labs, but, it just goes to show it is really important that we're getting a proper diagnosis, because the treatment of those may well be actually very different. And next week, I've got a question all about intervertebral disc disease, so slip discs in dogs. So make sure you tune in next week to hear all about that. But if we assume that Wendy's dog has arthritis, what can we do to help him kind of cope with maybe improve his mobility, certainly maintain the mobility that he's got, and lessen the impact that this debilitating disease has, and improve Wendy's dog's comfort? Well, there's kind of 7 key strategies or key parts of any arthritis management plan, certainly in my opinion. And so any arthritis management plan should involve at least considering all of these things. So the first one of those, which is absolutely huge and something that I believe very strongly about, is that's important for all dogs, not just arthritic dogs, is weight management. So obesity and being overweight is incredibly common. It's a case that up to or even over 60% of dogs are classified as either overweight or obese. And we know that a weight loss of just about 6% of body weight can make a big difference in comfort levels in arthritic dogs. So if you do nothing else and your dog is overweight, if they lose a little bit of weight, even if they don't get down to their ideal weight, then that is going to help their comfort levels. So weight management is really key. So recognizing whether your dog is a healthy weight, whether they're, piling on slightly too many pounds, or whether there's a serious problem with obesity is really important. Now, you can obviously talk to your vet about that. We can do something called a condition score, and I'll leave links to that in the show notes as well, that lets you know how we can go about doing that. And then coming up with a weight loss plan, which is a topic for another day. Again, I'll leave links to those in the show notes, because I've written several articles about that. So that's step 1. Step 2 is nutrition, so giving optimum nutrition. So that can be actually a weight loss diet. It could also be an arthritis specific diet, and they do have very good evidence behind them. So things like our Hills JD would be the kind of the classic one there, but there are other diets that are designed with the arthritic dog in mind that have been shown to improve comfort levels significantly in dogs that are fed those. So they work by a number of different ways. The big one is the component and the inclusion of omega fatty acids, so our fish oil essential fatty acids, which have can have a really good anti-inflammatory effect. They've also got glucosamine and chondroitin in them. They've got things in them that help maintain muscle mass and help reduce kind of fat deposition or improve fat burning rather than muscle burning if we're kind of trying to lose weight. So optimum nutrition is very important. Step 3 is environmental modification. So that involves things like putting non-slip mats down if you've got a hard, slippery floor. It involves things like using ramps, avoiding steps, to avoid steps so that there's no kind of tripping, slipping, falling, that kind of thing, or using ramps to get up into the car so that your dog's not having to jump up, avoiding those high impact activities. It can also involve having a nice, soft, conforming, comfortable bedding. So that could be something like a memory foam mattress, which would be absolutely ideal. They are a little bit more costly, but if you can't stretch to that, then just a really nice, soft, comfortable bed. Also being out of a draft. There's lots of different things that we can do in a dog's environment to help reduce the impact of arthritis. And you'll have to excuse if you heard my phone going off. I'm actually recording this while I'm on call, so I can't turn my phone onto silent, which I normally do. So you might hear it kind of beeping away there. But hopefully I don't get called out, because it's a bit difficult when I have to break out these podcast recordings into a couple of different sessions. I get out my flow. But anyway, that's by the by. So environmental modification is step number 3. Now, step number 4 is dietary supplementation. So some supplements are going to kind of, if you're feeding an arthritis diet, then certain supplements are kind of included in that diet. So there's no point in adding extra essential fatty acids, extra fish oils if you're feeding an arthritis diet. There's little point in adding extra glucosamine and chondroitin. But if you're not feeding an arthritis diet, then those things, certainly may be very beneficial. Now, dietary supplementation is a tricky subject. There's loads of supplements out there, and actually very few of them have good evidence behind them. And I'm a big believer that we should ideally be using things with good evidence. It's all too easy to be sold the dream that this one supplement is going to, completely cure or eliminate the effects of your dog's arthritis. That's a really emotional thing that people are selling you, but those are really, a lot of the time, they're kind of marketing hype, marketing words. And actually the supplement, it's really not able to provide the dream that it's selling. So, it may be that there's no physical harm to your dog, there's no side effects to provide them, but if you're spending money on these that could be used for a better, more effective treatment, then that is a significant side effect, if you like. Or if it means that you're delaying using other things that may make much more difference to your dog, then, that's something to consider as well. But dietary supplementation is definitely something to consider. My 5th thing to think about with an arthritis management plan is complementary therapies. So I'm thinking here things like physiotherapy, things like hydrotherapy, which are very important in maintaining joint mobility. So, stopping the joints seizing up, maintaining muscle mass as well. So it's all too often that our older arthritic dogs with an arthritic leg, they stop using that leg so much, so the muscle starts to go, which just kind of increases the mobility and the instability within a joint, and it's a little bit of a vicious circle. So complementary therapies can play an important role here. And then exercise management ties into that. So you want to be exercising your dog every day. Little and often is much better than your dog resting all week and then going out for a big long walk at the weekend, or running with you at the weekend when you go out and about. So little and often regular exercise, but also controlled exercise. So you shouldn't be throwing balls for your dog. You shouldn't be encouraging them to leap and to jump around. You don't want these really high impact activities of accelerating quickly, of slamming the brakes on, or of twisting and turning. If they're playing rough and tumble with another dog, then that's going to exacerbate the arthritis rather than just to help maintain that joint mobility. And then the final thing, which is very important, is pain-killing anti-inflammatory medication. And there's a whole raft of different things here. So the mainstay of treatment for arthritis when it comes to medication is going to be our non-steroidal anti-inflammatory drugs, things like Rimadyl, Onsior. There's a whole load of different ones. Metacam. There's loads of different brands out there and different active ingredients that all fall under the same class of drug. But then there are other things. So things like gabapentin, amantadine, paracetamol. There's lots of different options out there as well. So we definitely need to consider painkilling and anti-inflammatory medication as well. And then the final thing we need to do for an arthritis management plan is we need to monitor how effective that is. So you can see there's lots of different things to consider, and it's not going to be the case of starting every single one of these things at the same time. although, that would be fantastic. We should certainly be considering them and starting them where appropriate, but we want to monitor how effective they are. Be aware that arthritis is a degenerative condition. It's a progressive condition, so it is going to get worse with time. And it also does fluctuate with time. So you'll have kind of flare-ups of arthritis where the pain does seem a lot worse, but then it settles down again. And then maybe it's even better than normal, so it fluctuates normally. But we want to be monitoring for that. We want to modify our plan where appropriate. So if it is getting worse, we need to take steps to get it back to your dog back to a more comfortable level. So we need to be, again, looking at this plan and seeing where we can make changes. And then once everything's working, we need to maintain that treatment. So there's no point starting everything, making all these changes in the house. And then, if you move and you don't make any of those changes in your new house, then, unsurprisingly, your dog is probably going to go backwards. So we need to be maintaining whatever it is that's working. So, if we're taking all of these things into consideration, we stand the best chance of helping any dog who is starting to, develop or starting to show signs of arthritis. We're going to help keep them comfortable. We're hopefully going to slow down the progression of that disease and make sure your dog's life is as happy as possible. And then just bear in mind that I don't know your pet personally. And so the information that I give in these podcast episodes is only a guide, and it's not specific advice for any individual dog or cat. So always check in with your vet if your pet has any health concerns, you have any questions, or if you're unsure about anything to do with your pet's care.
Get your questions answered at callthevet.org.
And so the second part to Wendy's question was really how to help a dog who's showing signs of senility and dementia. So senility or dementia, it's also known as canine cognitive dysfunction, is really common. Now, estimates vary that this affects a whopping 60% of dogs who are over 8 years of age, with over 60% showing signs of this problem, and then a more modest 14% may be suffering. So that depends on where you're looking at. But even if only 14% of dogs who are over 8 years old are starting to suffer from senility or dementia, that's still a huge number of dogs, and only a fraction, only the tip of the iceberg, are recognised as suffering from this problem, and significant steps taken to make a difference. I think it's probably likely that a lot of us recognise this is a problem, but think that there's very little that we can do. And there's certainly no magic bullet, there's no magic treatment and pill that can be given that will miraculously eliminate all signs of dementia or senility. But there are things to do which which I'll come into. But before I jump into those, I just wanted to talk about the signs of senility or dementia or canine cognitive dysfunction or whatever it is that you're calling it, just so that you can, have a little think to see if your dog's suffering from it. So it is a problem in older dogs typically, so dogs over 8 years of age, probably dogs, that are older than that, it's more common in, so the older it's probably more likely. And we kind of have an acronym for the signs of senility, which is DISHA, so DISHA, and that breaks down as D, so is disorientation. So if you're finding that your dog is wandering aimlessly into rooms, they look like they're not really sure where they're going or why they're kind of walking around, then that's one sign. I is for interaction reduction. So that's interaction with you, maybe other family members. They're just not interacting. They're not coming up to see you as much. They're not wanting to play. Now that can obviously be a sign of arthritis and lots of other things, and so I'll go back to the last question, but they might also be interacting less with other pets in the house, with their other dogs or other cats that they're normally quite close and friendly with and playing. So interaction reduction is another sign of dementia. S is for sleep wake cycle changes. So we'll typically get dogs who suddenly become awake at night rather than sleeping. They might be getting up or waking up a lot earlier than they ever used to. So, that sounds like something is the case with Wendy's dog. So sleep wake cycle changes. H is for house soiling. So if your dog's always been, really good, then they might be having accidents in the house. So that could be either urinating or defecating. Now that can be signs of other things. So that can be signs of bladder problems, it can be signs of kidney disease, diabetes, intestinal disease. So a little bit like the first question when I was talking about that cat soiling. So inappropriately out the litter box. Well, the same thing can be with dogs. There can be other medical problems, but house soiling is definitely one thing that we can see in dogs with dementia. And then A of the DISHA is activity changes. So they generally become less active, or maybe they start doing things that they never normally did. So just changes in their activity levels. So those are all signs of senility or dementia. And yeah, like I say, there are other things that can cause all of those problems. If your dog is showing one of those signs, then, we have to ask the question. We have to just think, well, is there a problem with developing dementia? If your dog is showing two or more signs, then, that does make this diagnosis a lot more likely. Now, the problem with this diagnosis is that, we don't have ready access to MRI machines. We don't have unlimited funds to pay for, advanced diagnostic imaging of the brain. So, it's not something that we can easily diagnose. It's more a diagnosis of exclusion, meaning that we rule out any of the other common things that could be causing that problem. So, we rule out arthritis, we rule out bladder infections, kidney disease. We try and make sure that there's nothing else going on, and then that leaves us with a diagnosis of canine cognitive dysfunction. So, once we've reached that diagnosis, well, what can we do about it? Well, if a dog has got mild to moderate senility, then we can try treatment with a number of different things. So we can try antioxidant supplements, so things like SAMI or milk thistle can help. We can give herbal supplements, so something called ginkgo biloba. I think I'm pronouncing that right. Ginkgo biloba may help to improve brain blood supply and improve brain function. Diets rich in medium chain fatty acids, which things found in things like coconut oil, but also in certain kind of specific brain diets, if you like. Prescription diets have got rich in medium chain fatty acids, and what that does is actually those fatty acids get converted into something called ketones, which can be used as an extra energy source by the brain. So those are kind of things that we can give our dog. Now, none of those things is going to definitely have an effect. They may make no difference at all, but they may make some difference, and in some cases they can make quite a lot of difference. Other supplements, something called Activate is another herbal supplement, kind of dietary supplement that's specifically designed for dogs suffering from canine cognitive dysfunction. And again, there's kind of mixed response to that. I've certainly had patients myself who have responded very well to Activate, but equally a lot of them haven't. It hasn't made any difference at all. There's no harm in trying it apart from the cost involved. So that's something else to have a think about. And what I'll do, so there's a lot of information here, and there's a lot of extra, information that you might be interested in. And I will leave links in the show notes to some further reading if you're interested in kind of learning more about these things that I'm mentioning. And then other things that we can do just to help improve your older dog's brain function, we can encourage them to use their brain. So kind of a little bit of a use it or lose it situation. So encourage interactive play, so you can use puzzle toys, use food toys. There's really good things there. So if you're feeding your dog in a bowl, get rid of the bowl, use things like a snuffle mat or a licky pad, use a maze bowl, use specific food puzzles, treat balls, just to give your dog something to do, something they have to think a little bit to get their food. That's stimulating, and that's great for their well-being anyway, with any dog of any age and any mental kind of ability. But certainly getting your older dog to use their brain a little bit more is important. And then you can even teach your old dog new tricks. Now, you absolutely can do that. They might need to be simple tricks. You're not going to get them doing backflips through hoops when they've never done that before, but teaching your dog some new tricks or new skills, a high five or a shake paw or roll over or something like that. It's great for bonding. It's great for interacting with your older dog. Their interaction levels can reduce anyway. They can get a little bit slower, and that can cause us to maybe ignore them or not spend the time and the effort with them that we always used to. So teaching your old dog new tricks anyway is always going to be a good thing, but can definitely help them to use their brain a little bit more. Now, if your dog is showing more serious signs of senility, or if a more aggressive approach is preferred, then there are some drug therapies that we can consider, and there are a few options, and licensing does vary depending on where you are in the world. So one option is selegiline, and another option is propentof. And another option is propentophyline, which is trading as Vivitonin. So those are all things that are licensed for the use of for dogs with canine cognitive dysfunction. Again, in some dogs, they seem to make a really huge amount of difference. In many dogs, they either have no impact or they have a low impact, so they never get a dog kind of quite back to how they were. Definitely, if that's all that's going on, if you can afford it, there are definitely things to consider. And I think very often we kind of pass this disease off as there's nothing that we can do about it, but or there's nothing that's going to make any difference. But absolutely, I think especially if we're tackling things early, then there's more chance that things will work. I've got no evidence to back that up, but I kind of imagine if something is going to work, it's going to work when the changes are only very mild. And if we're doing a few of these things again, there's going to be more likelihood of these interventions working as well as possible. Now, the other thing with this disease is that actually it's very similar to Alzheimer's disease in people. So the changes in a dog's brain with dementia are very similar to people suffering from Alzheimer's disease. So this is clearly then something that is, a pretty hot topic for human research. And there's a lot of research looking into trying to find a cure for Alzheimer's disease. So it may very well be in the future that we've got some much more effective treatments, and things like immunotherapy have been suggested as potential treatments for this. So, definitely watch this space. These treatments aren't imminent. Certainly to my knowledge, they're not imminent, but in the future, there may very well be something that we can actually very effectively use to treat cognitive dysfunction in dogs. And then, like I say, if you want more information about all this, then make sure you check out my article that I'll link in the show notes. So that's it for this episode of the podcast. Be sure to subscribe if you're not already and you enjoyed today's show. And if you do have a spare couple of minutes and you did enjoy the show, then I'd really appreciate it so much if you could leave me a review over on iTunes or over at ourpetshealth.com/review. So reviews just help so much with podcast discovery and surfacing different podcasts in the algorithm. And, leaving a review will help more than you can imagine. So I'd appreciate that so much, just to allow me to help more pets. And if, reviews aren't your thing and you'd rather just share this episode with a couple of your pet owning friends that you think would benefit from it, then that would also be hugely appreciated. Also, remember too that if you head over to callthevet.org, you can submit your question to be answered on an upcoming episode. And you'll also find all the links and downloads mentioned in today's show. But until next time, I'm Dr. Alex. Take care.
You've been listening to Call the Vet. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show that answers all of your pet questions.